Hello everyone, I am Dr. Mahalakshmi, educator, forensic medicine and toxicology. Now what you are going to see is biological stain, and this biological stain, this is more of a forensic science topic. So this is not forensic medicine, this is forensic science topic. But why we are studying this is that even though analysis, testing, everything is done in the forensic science lab, the preservation is usually done by the autopsy surgeon. The doctor, treating doctor or the autopsy surgeon, only they will be preserving the samples. So we have to know what is the importance of the sample preservation, what to preserve and how to preserve. That is why we are seeing this biological stains. So all the biological stains, it acts on only one principle, that is Locard's exchange principle. So this is the principle which guides this whole biological stain examination. So according to this Locard exchange principle is that anything that comes in contact, okay, something that comes in contact will leave a trace in it. So this is the basic idea beyond which we are doing this whole thing. So according to this, the Locard principle, if something is having a contact, if two objects are coming into contact, both the objects will leave some sort of trace in each other. So this object A will leave a trace in object B and B will leave its own trace in object A. So based upon this principle only, we do all this sample collection, preservation and testing. So in this mainly we will be seeing seminal fluid and blood stain. So we have all other stains also, we have saliva stain, we have urine, fecal stain, everything. But the main thing in this is seminal stain and blood stain, because that is the most commonly encountered stain and most important stain that we need to know how to preserve and how to send for analysis. So first we are starting with the seminal fluid. So seminal fluid, it is usually done in civil cases and criminal cases. In civil cases, it is usually done for paternity disputes. In case of paternity disputes, we will do seminal stain analysis and try to find out the result. In case of criminal, you will be doing it for rape. Mostly in rape, you will be trying to identify the attacker. So these are the conditions where we will be doing seminal fluid analysis. Now, basic ideology regarding the seminal fluid, like the normal quantity that you can expect is 2 to 5 ml per ejaculation, and in this 2 to 5 ml per ml will have around 60 to 150 million sperms. Each ml will contain this many sperm, and normally you will get around 2 to 5 ml per ejaculation, and pH of this fluid will be 7.4. And this sperm, it will have three parts, that is your head, middle zone and tail. And this head, it will have something known as acrosome. So this acrosome, it is responsible for the penetration and acrosomal reaction. So this will to enter the egg, to go beyond the membrane of the egg. This acrosome will have certain chemicals which will undergo the reaction, opening up the gate, and the sperm will enter the egg. So this is the acrosome. Along with that you have the nucleus. So that is the head, and that forms the major part. Then you have middle piece which contains mitochondria for energy. Then finally you have a very long tail which acts as the flagella for moving. So you will have a motile sperm, it will keep on moving, and if it is a recently ejaculated sperm, you can see the well motile sperm under microscopy. So sperm, you basically have head containing nucleus and acrosome, Acrosome is responsible for penetration into the egg. Then the middle part containing the mitochondria for energy. Then last the tail, which is the flagella used for motility. So this is the part of the sperm. And how we usually collect the seminal stain? So what happens is that if it is for paternity dispute, you can directly collect the seminal fluid after ejaculation. But if it is a criminal case, this is where we actually come in. What happens is that you will be getting stains. This is what you mostly get. You will be getting stain, and it can be in a porous or non-porous structure. So porous structure as in some clothing, or sometimes you can get matted hair. Non-porous you can get over a solid structure. Over a solid structure you can get these stains. So now what you will do is, if it is a cloth which contains the stain, what you have to do is, you have to air dry the cloth, and you have to properly fold it and preserve in a paper bag and send for analysis. See, this preservation and drying up everything, it is the same for blood also. So whenever you get a very wet stain, what you have to do is, you have to air dry it. You should not dry it under sunlight, because what will happen if you use sunlight, the protein will degrade and you will not be able to identify the semen or the blood in it. So you have to air dry it. If you don't dry it, there will be fungal formation and you will lose the evidence. So you have to definitely air dry it, and you have to fold it properly. Like if there is two stain, like in a single clothing, if you have two stain, you have to make sure like both the stain are not coming in contact. It have to go in the opposite direction. Like that way you have to fold it, and you should preserve it in a paper bag, not a plastic bag, because paper bag will prevent any fungal growth. Paper bag, if you use, it is better, but mostly you have to avoid this plastic bag. So air dry it, fold it properly, preserve in a paper bag and send it for analysis. This is how you preserve when you get it in a clothing. If you get a matted hair, what you have to is, you have to cut. You have to cut the hair and you have to preserve it. After drying, you have to preserve it. Same, in the paper bag you have to send for analysis. So that is how you preserve in a porous structure. If it is a non-porous structure, like you are finding it in the ground, some tile somewhere, if you are finding it, what you have to do is, you have to scrape the stain. You have to scrape the stain area and you have to send it for analysis. In a paper bag. So mostly you have to preserve it in a paper bag only. So this is how you will collect. And what you have to do is, sometimes what you will see an area over the body where stain is there. You could see that a seminal stain as a white kind of starchy stain you can see in the body. Under that situation, what you have to do is, if it is seen over body, you have to take a wet swab and you have to roll it over the stain, then send for analysis. This is how you have to preserve. So this is normally preservation is done, and when you preserve this and you send it to FSL, what they will do is, they will do certain testing to find out whether it is actually a seminal stain or not, and whether it belongs to human or not, and whether you have motile spermatozoa or not, and even DNA analysis would be done. So all the analysis will be done in the FSL, and these tests these are very important in exam point of view. They have repeatedly asked these questions. So first, for seminal stain examination, you have these important tests, that is serum acid phosphatase, barbario, fluorescence, creatinine phosphokinase and P30. So we will see the important aspect of this each and every test. So first thing, serum acid phosphatase, what you will look for is the same thing, serum acid phosphatase. This is what you will be looking for. In barbario test, just remember this, S bank. So B for barbario. Here what you will be looking for is spermine. So S for spermine, you will be looking for spermine. In fluorescence test, remember FCB. So you have fluorescence and you will look for choline. So you will look for serum acid phosphatase there. Then you will look for spermine in case of barbario, choline in case of fluorescence test. In CPK, you will look for creatinine phosphokinase. This is what you test for. And in P30, you will look for prostate specific antigen. This is what you will be testing for. These are the things. And what is the color that you will be getting in this? Normally here you will not be getting any color, but in this fluorescence and barbario you will be getting color, and they will ask you what you will be getting. In case of barbario, we have Y and E, right? So here you will get yellow color rhombic crystals. You will get yellow color rhombic crystals. In case of fluorescence, you will get brown crystals. So FCB, B for brown, S bank, YE for yellow. So you will get yellow color in barbario, brown color in fluorescence. This they will repeatedly ask which color you will be getting in what. And these are crystals of spermine picrate. So you will be using picric acid and it will go attached to the spermine. So you will get spermine picrate. And here what you will be getting is brown crystals. So this is the thing that you have to remember in these tests. Apart from that, there are certain special feature that is specific to each and everything. So first is this SAP. Here what is the special feature is that even after long time, it will give positive result. It will give positive result even after long time, and it does not need to have sperm. The seminal stain, like even in infertile person, you will be able to identify, because it will only look for the serum acid phosphatase in the sperm, like in the seminal fluid. It will not look for this sperm. So you will be able to identify even if they are infertile. So this is the special feature of this test. Next what we have is this P30. This P30, the special feature here is that this will give positive result in azoospermia, because you are looking for this antigen only, the prostate specific antigen only you are looking for. So even in azoospermia, it will give the positive result. And this CPK, even in very old sample, very old putrefied sample, you can get positive result. So these are the specific feature for these tests. Commonly used is this barbario only, and it is a commonly asked question also, but the most specific features is this. This P30, it will give even in azoospermia, and putrefied sample you can get in CPK, and this give in, like if it is not putrefied, if lot of time has passed, even in that, if there is no sperm also, with the presence of seminal stain only, we can get positive result in this SAP test. So this is the important test. Next, we will do immunological test to identify the species. So here what we have is monoclonal antibody. So this monoclonal antibody, this will go and find this 4E6 antigen which is present in the seminal fluid. So this is very specific to our human, and this MAB4E6 is used in immunological test to identify the species. Apart from that, you will also have this seminal vesicle specific antigen where you can identify the species, and you can always use fish for identifying the species. So all these MAB4E6 and fish technique is used for immunological identification, that is species specificity. And microscopy is very important because a single motile sperm confirms recent sexual activity. So even if you don't get positive result in all these and you are able to see a single motile sperm in the microscopy, then you can definitely say that there had been a recent sexual activity. So that is the importance of this microscopy test. So basically you have to remember these tests: SAP, Barberio, Florence, CPK and P30. So Barberio and Florence you have to remember the color, and all other there are some specific features that you have to remember. Barberio use the mnemonic S bank. So B for Barberio, you get yellow color spermine picrate. So you will test for spermine using picric acid, you will get yellow color spermine picrate. And Florence test, you will look for choline and you will get brown color. And CPK P30, this is very useful because P30 even in azoospermia it will give positive result. CPK even putrefied sample will give positive result. And if you want to identify the species, you have to look for this monoclonal antibody test and fish technique. And finally microscopy, where you see a single motile sperm which will confirm the recent sexual activity. So this is about the seminal stains, and this is very important. They will ask you 2 mark or sometimes they will ask you in MCQ also. Next is blood stain. So when we go to blood stain, the first and important step is how to preserve. It is same as the seminal stain. If it is in a porous, you will preserve the clothing, hold it properly, send it in a paper bag. If it is non-porous, you will scrape it and you will send for analysis. But here what happens is that you will get lot of red color stains. All the red color stains you may suspect it to be blood, but you have to identify. You have to identify whether it is actually blood or not. So in this what you have to do is you have to first make them go through this presumptive test. So through this presumptive test we will be able to do away all the negative stains. All the negative stains. That is, see, if the presumptive test become positive, then there is more probability, there is more probability that it is blood. Okay, presumptive test is positive means it is probably blood, but if it is negative means then it is definitely not blood. So simply it has high sensitivity and low specificity. It can always exclude all the stains that is not blood, but to confirm you have to do another test. It is not specific but it is highly sensitive. Even if a drop of blood is there, it will definitely sensitize, but you will not be able to say whether it is actually blood or not. So sensitivity is more, specificity is less. So it gets negative means you don't have to worry, you can just leave the stain. But if it becomes positive means you have to do another test to confirm whether it is actually blood or not. So this is the important aspect of this presumptive test. And presumptive test we mainly have color test. So color test we have all these tests. So first is this benzidine test. So this benzidine test we use glacial acetic acid along with this benzidine, and if it is a positive reaction, you will get blue color. If it is blood, you will get blue color. And since this benzidine is highly carcinogenic, they replaced benzidine with this orthotolidine. So, replacement of benzidine is orthotolidine, and this is very useful. Even old stains, very old stains, it can identify. So, this is the important color test that is used for presumptive test. So, first is this benzidine, which is replaced by this orthotolidine because benzidine is highly carcinogenic, and positive result means you will get blue color. So, this is the first test. Next, what you have is Kastle-Meyer, also known as Phenolphthalein. We have Kastle-Meyer, also known as Phenolphthalein test. Here you will get pink color. If it is positive, you will get pink color. Next, what we have is leucomalachite green. Okay, leucomalachite green. So, here what will happen is that you will use something known as McPhail's reagent, and this McPhail's reagent, if it detects blood, it will become green in color. So, it will give green color. Positive means it will give green color. And the main disadvantage of this test is that it will obstruct the DNA yield. Like if you use the stain under this reagent, you will not be able to use it for DNA analysis. This is the main disadvantage of this leucomalachite green test. So, these are the color tests. Benzidine and orthotolidine, it will go blue, and this is highly sensitive and most commonly used. Even in old stain, they can give positive result. Next is Kastle-Meyer or Phenolphthalein test, which will give pink color. Another is this leucomalachite green, where we use McPhail's reagent, which will reduce the DNA yield, and this will give green color in case of positive result. So, these are the color tests that we use as presumptive test. Next is this Luminol test and fluorescein test. So, what these tests is? So, Luminol, it works under the chemiluminescent principle, and here fluorescent, it works under fluorescent principle. So, what happens is that in luminol, if you spray the luminol, all this area of stain, it will light up. So, there will be a chemical reaction which will emit light. So, there will be a chemical reaction when you spray the luminol over the blood stain. Because of the chemical reaction, there will be light. So, that is how you identify whether it is a blood stain or not. This is very sensitive, highly sensitive, and most commonly used. Next, what you have is fluorescent test. So, this fluorescent test, it will emit light, like it will become fluorescent, and you have to look under another source of light, like infrared, some other light wave you have to use to visualize this. So, most commonly used is luminol, which uses the principle of chemiluminescence. Like because of chemical reaction, there will be emitting of light, and it is usually seen in dark conditions. So, most commonly used is luminol and the orthotolidine test. So, these are the principle of the presumptive test. So, we are done with the presumptive test. We are getting positive reaction. Now, we should subject that positive reaction to another test, that is confirmatory test. To confirm whether it is actually blood or not, we have to do this test. So, first is microcrystal test. This is one confirmatory test. So, first you have hemin or Teichmann test. Hemin or Teichmann test. Next, you have hemochromogen or Takayama test. Then finally, you have Wagner or this acetone chlorhemin test. So, these are the microcrystal tests that we commonly use as confirmatory test. So, in hemin, what you will get is, you will get dark yellow to brown rhombic crystals. you will be getting this crystals if it is blood. And in case of hemochromogen, what you will be getting is pink feathery crystals. So these two are very important. What you will get in hemin and what you will get in hemochromogen. These are very important, and these three consist of microcrystal confirmatory test. So presumptive test will tell you whether it is blood stain or not. So if it is negative, then it is definitely not a blood stain. If it is positive, then it may be a blood stain. You have to subject it to confirmatory test. So confirmatory test, first we have microcrystal test, which consists of hemin or Teichmann, Takayama or hemochromogen. Then you have the Wagner test, which is acetone chlorhemin test. And in hemochromogen or Takayama, you will get pink feathery crystal, and this is highly reliable. This is highly reliable test. So this is one mode of confirmatory test. Next, what we can do is another confirmatory test, which is spectroscopic studies. So we will do the spectroscopic analysis and we will be able to identify whether it is actually blood or not. So you will run all the electrophoresis and you will be identify the spectrum and you will be finding out. Also, you can do species origin by doing immunological test. By doing immunological test, you can identify the species origin, whether it was actually, like all these tests, they will tell you whether it is blood or not. But it will not be able to tell you whether it is a hen blood or human blood. So to find out the species origin, you have to do this immunological test. You will be doing this agglutination, inhibition test, everything you will be doing to identify whether it is actually a human blood or not. And finally, you can do microscopy to look at the shape of the RBC. This can also help you identify the species. So for identification of species, you can do this immunological test and this microscopy also, where the structure of the RBC, shape of the RBC will help you identify the species origin. So seminal stain, there was no presumptive or confirmatory test. We simply had few tests. For immunological tests, we used for species identification. But in case of blood, you had presumptive test, then you have confirmatory test, then you also had species origin test. So these are the important aspect of blood stains that we have to know. So seminal stains, blood stains, very important, and one another is Edelman test. So this Edelman test, this is for fecal stain. For finding out fecal stain, we use this Edelman test. And the reagent that you use in Edelman test is alcoholic mercuric chloride plus zinc chloride. So this is the reagent used, and this is a important 2 mark and MCQ. So Edelman test, it is for identifying fecal stain, and the reagent that we use is alcoholic mercuric chloride and zinc chloride. So these are the biological stain that we have to know. And the most important aspect of this as a autopsy surgeon, as a treating doctor, is you should know how to preserve a sample. What is the preservative that you have to use? How should preserve it? Paper bag or plastic bag? That you have to know. This is the takeaway point in this, and thank you for watching.